Hello, my name is Esther Shadari. This is my stakeholder education plan for Bremen University regarding my clinical scholarly project. Schizophrenia or schizophrenia spectrum disorder is one of the leading causes of chronic long-term disability in the United States. It contributes negatively to one's personal, social, and economic aspect of life. The heavy burden associated with schizophrenia illness is due to the challenges that the clinicians face when attempting to treat patients diagnosed with schizophrenia. These challenges are noted but not limited to relapse, frequent relapse, persistent psychotic behaviors, non-adherence or non-compliance to medication, recurrent hospitalization, as well as the burden on the healthcare available resources. In the attempt to treat patient diagnosed with schizophrenia, clinicians use both oral and injectable, also known as long-acting antipsychotic injectable. Long-acting antipsychotic injectable are mainly used in order to help promote the adherence of antipsychotic medication used to treat patients with schizophrenia, which also help in promoting compliance and adherence to medication. In conducting my clinical scholarly project, I would like to discuss the stakeholders in this study. I have the administrations that will oversee the entire cost of implementing the project and safety of all participants, which includes the providers, that is the NPs, the medical doctors, the therapist, the certified medical assistants, the office manager, as well as the participant. The administration will place all orders necessary, adequate office supply necessary for this project. They will print the educational booklets or the clinical forms necessary for this project, as well as provide a balance in scheduling patients for the necessary interventions in order to complete the study. The providers will help in screening patients or the subject for this study. They will define the current practice or pattern that has been used in the past or currently being used as an intervention. They will evaluate and document project intervention outcome that is associated with the current medication, effectiveness of the current treatment, compliance and adherence, relapse, as well as hospitalization. The providers will make sure to inspect all the documents that are being given to the participants to make sure that it is in compliance with the American Psychiatric Association care guidelines. The certified medical assistants will take vitals and document all the vitals taken on these patients. They will administer the long-acting antipsychotic injectables, and they will also schedule patients for next dose of the long-acting antipsychotic injectable. The office manager will ensure that they answer all phone calls. They will make sure that there are adequate supply of the adequate office supply necessary to complete this project, as well as scheduling patient for the necessary intervention as needed. The patients will be motivated to complete and stay throughout the entirety of this study. They will follow strict intervention that has been given by the providers and also comply with all the follow-up appointments whereby it's for medication or therapy session. Theoretical model or framework. A theorist or theory provides framework necessary to guide the development and implementation of health intervention. The theoretical framework that I have chosen for my clinical scholarly project is the Bandura social cognitive theory. The Bandura social cognitive theory fits well with this population because social cognitive theory defines learning that is affected by cognitive, behavioral, and environmental factors. Social cognitive theory is just in patients that are diagnosed with schizophrenia because it helps prevent, treat, and manage this illness through behavioral changes intervention. This intervention help this population because they provide the skill necessary to have control as well as improve their health outcomes. The implementation plan for my project, in order to fully implement my clinical scholarly project while putting Bandura's social cognitive theory in play, I will be utilizing cognitive behavioral therapy. I'm using cognitive behavioral therapy because it shows a major advantage on patient diagnosed with schizophrenia. It helps with the negative and the positive symptoms associated with this illness, helps with the mood, as well as social functioning, as well as the social anxiety associated with patient diagnosed with schizophrenia. The positive symptoms associated with patient diagnosed with schizophrenia are the psychotic disorder noted, which is hallucination, delusions, disorganized speech, and behavior. The negative symptoms include affective flattening, poverty of speech, and avolition. Cognitive behavioral therapy is an alternative way to help reduce the psychotic symptoms in patients diagnosed with schizophrenia. It is very effective on both the positive and the negative symptoms, whereby reducing the hospitalization time of patient diagnosed with schizophrenia and also reducing hospitalization of patient diagnosed with schizophrenia. In order to complete my clinical scholarly project, I will be including the NP and the medical doctors that will help to assess patient diagnosed with schizophrenia. Upon assessment, the provider will assess the effectiveness of current medication regimen that is being used for this patient. Once the patient is seen to be non-compliant or has had frequent hospitalization, the NP or the MD, in conjunction with the therapy, will enroll the patient into the study. The patient will be educated on both long-acting antipsychotic injectable as well as cognitive behavioral therapy and its effectiveness. Once the patient chooses to undergo the study, they will sign a consent form stating that they will adhere to all the instructions given regarding the medication as well as therapy. This study will take about 3 months because it takes up to 4 weeks for any long-acting antipsychotic medication to be adjusted, for the dosage to be adjusted at any time. All the providers in this study will have to fully and properly document both interventions that are used in this study in order to properly measure the efficacy of the study. The educational intervention plan. The major goal in healthcare system is to achieve positive outcome in interventions that are used on patient. In reference to practitioners caring for patient diagnosed with schizophrenia, the ultimate goal is to prevent relapse and promoting successful rehabilitation. In sight of this, patient diagnosed with schizophrenia must maintain proper medication adherence in order to prevent relapse and hospitalization. Therefore, in endeavor to prevent relapse and hospitalization and cost that is incurred while treating patient with schizophrenia, it is essential to educate patient on compliance and adherence to treatment plan that has been created by the provider. By doing so, this will help to reduce the positive and the negative symptoms that are associated with schizophrenia, consequently reducing hospitalization of these patients. The benefit of my clinical scholarly project will increase compliance and adherence to medication or treatment plan that has been established for patient diagnosed with schizophrenia. Most importantly, my clinical scholarly project will reduce relapse, hence reducing hospitalization amongst this population. Thank you very much and have a good day.